Monica, I like your background with that Indian flag.
Yeah, I was just telling her, very apt background, Monica. Very, very apt background for today.
I think you're on mute.
You're muted. You're muted.
We are live. We are live, sir.
Good afternoon, everyone. I think it's a very historic day for India as the bill, the Allied and Healthcare Professionals Bill, is currently being debated in Lok Sabha, and which would get passed very soon. So it's great for India. It's great for the eye care profession. So what we're going to do as part of this panel discussion is we have 4 eminent panelists who are going to share a little bit on the bill, what it means for the profession, for India more broadly. And after that, we'll open it up for questions and discussions. Now, the panelists need no introduction. We have Mr. Rajesh Wadhwa, who's the CEO of Wadhwa Optics and the former president of the Indian Optometry Federation. We have Ms. Lakshmi Shinde, who's the CEO of the Optometry Council of India. We have Mr. Ramachandran, who's an honorary advisor with India Vision Institute, but he was also the former chief operating officer for ESLO, and he was with ESLO for about 20 years. And we have Professor Monica Chowdhury, a contact lens and low vision specialist, retired senior optometrist with the All India Institute of Medical Science and ex-director School of Health Sciences, Ansal University. Each one of the panelists would have 5 minutes for their broad opening comments. After that, we'll have a time for informal discussions and questions. I request the others who are logged in, if you have any questions, please do type that in the chat box. Over to you, Rajesh.
Thank you, Vinod. And it is definitely a historic day, and I'll be mentioning it during my talk. And I would rather put everything onto the screen with a screen share. So let us look at what this bill is about in a very short summary. Okay, is my screen visible? Hello? Is my screen visible?
It is visible. You just need to click on your...
Right, sure. So we are going to talk today about demystifying the National Commission for Allied and Health Professions Bill 2020. And as we talk on this, well, thank you for introduction, Vinod. Just for all to know, I'm primarily an optometrist, but also happen to have qualification in law with specialization in medical law and bioethics. So this becomes a subject of great interest to me further. This particular image is very, very precious. And what does it symbolize? It tells us that after years of...
Rajesh, you got to open your presentation. I don't think you opened that yet.
Your presentation is not visible. We can see your screen. Which is
you got to just click on the...
It was, okay. I'll have to take up the other screen.
Yep. Yeah, now it's...
Yes,
now
you can see that now.
Yep, thank you.
But it's not forwarding now. Yes, there it goes. So after years of struggle and selfless contribution to the profession by our predecessors, we have hope of seeing optometry and others covered under ophthalmic science professionals as recognized profession in India. That calls for an applause because there has been a lot of hard work which has gone by. The National Commission for Allied and Healthcare Professions Bill 2020, it will be called an act. It is currently a bill. Once passed by both houses of parliament and the president gives his assent. And why this bill is required is what is very important for us to know today. Ophthalmic sciences professionals are optometrists, ophthalmic assistants, and vision technicians, and they will be registered through this bill, regulated, and will be healthcare or allied health professionals, as they will be classified and will have more rights. Responsibility and answerability will increase. There is no rights which come without a responsibility along with it. So we'll have rights and there will be answerability also. Ophthalmic science professionals will have a code of ethics. There will be rules which will guide. There will be a qualification required. There will be behavior control. They will be required to be polite and kind to the patient. The performance will be assessed. We will have strict accountability. And in summary, what will this act achieve is, there are two screens to this, little busy slides, but let's go through this. Number one, it defines who is allied health professional. He'll be an associate technician, technologist, and who will be healthcare professional. He'll include scientists, therapists, people who provide preventive and curative or rehabilitative services in health. It sets up a national commission for allied health. Commission will be national, but the process will be mostly performed by the state level. So while national level, it will be called a national commission, at state level, this commission will constitute various state councils. So at state level, it will be called councils, all will get registered there, and the state register will populate the national or the central register, wherein all the registered professionals will be there. Prior permission of the state council will be required to establish a new institution or open new courses. Only persons enrolled in the state register or national register are allowed to practice. Not registered and falsely representing as registered will have a lot of punishment. Here is just an example. First conviction of such a kind will be having a fine which may extend up to 1 lakh rupees. And on a subsequent conviction, it will also add on imprisonment which may extend up to 1 year, and the fine will go up to 2 lakh rupees. And this is quite a deterrent, and I don't think over a period of time, unregistered people will ever say that they have been registered there. The AHP Act is yet to come. We are discussing the interpretation of this bill, which has not yet been passed by the Parliament to become an act. Therefore, this may be considered as proposed law, what we are discussing right now in this meeting. There might be some changes to the final act. Already it was introduced in Rajya Sabha on 15th of September 2020 and now passed by the upper house 1 week back, that is March 16, 2021. And expected time of enactment is just today. While we are talking here, the discussion in Parliament is on. This is 24th March 2021. It's going to be a historical day today. And after passing in Lok Sabha and then getting President's assent, it will be a law. With this background, we can elaborate further. Even after all this discussion is over, you're welcome to contact me. My contact details are here. You can take a screenshot of this and we'll be able to discuss, or I can answer your questions even later on. Thank you, and over to you, Vinod.
Thank you, Rajesh. Yeah, so over to you, Ram, for your opening comments.
So, good afternoon, everybody. And I think it's a historic moment. I think all the panelists, the distinguished panelists sitting there, I think they need a big congratulations for the kind of efforts you have put in over decades in bringing this unrelentlessly without any personal pursuits. I think it's hats off to all of you who have really worked towards this. I just broadly look at, just to give a perspective for the entire industry, I would like to talk about the mission statement of the bill, which perhaps will reflect upon what is the reason why this bill has been put in. So the Allied and Healthcare Bill of 2018 provides for regulation and maintenance of standards of education and services by allied and healthcare profession. And thereby, like what Mr. Vadva had mentioned, is the maintenance of central register and for allied and healthcare professionals will have to happen there too. So the bill provides for recognition of 53 professions in which optometry also is being recognized. Now, this gives us an opportunity for India to look at this industry, which is quite fragmented, and there is no threat for any optician to worry about. The only question or any practitioner to worry about, the only question which could be is that the person who can do a kind of The first one is this is going to regulate the education part of the overall aspects of optometry. And so we cannot call anybody with, to put it in a layman's language, an optometrist without a 4-year qualification. And then 2 years will be called as a vision technician or ophthalmic assistant, which comes under ophthalmic science per se. But for an optician to practice, there's nothing wrong. There's nothing that he has to shut shop or something like that, the fear of any other businessman. But as long as he has got the right people to do within the framework of the law, like an optometrist to practice or to check the eyes. So given that, there is, I think we have to really recognize, appreciate the efforts being done, and we have to work towards making sure that it's a big task in hand. It's just the beginning. The bill is a historic day today, and it's just the beginning of a long journey. I think we'll have to work together, get everybody across the board, the opticianry part, the ophthalmologist side, who are also a big contributor to the eye care sector. The optometry is getting recognized, which is remarkable, which is better late than never, but I think they deserve to be recognized now. And I think overall things are falling in place. We need to also perhaps during discussion time talk about how we are going to look at the online the business, which is now becoming, I would call it as business, because the eye care is the secondary part of it. The business comes first. So I think we need to look at how do we navigate this, and keeping in mind that this is going to be a law, and make sure that we all abide by the law. And as rightly put by Rajesh ji on that, especially on the way this will be. Now there's no more question of discussing about what to do. It's a law. So either we follow that or we are going to be penalized. I think that's how we need to look at it. So the question is, how are we going to make sure that everybody, all these stakeholders are taken into consideration, give the space for people to do their job. And I think the industry will grow manifold now. I think the time has come for India to eye care sector to grow probably 5 times in next probably 5 to 10 years time. I think it's a great day, and thank you, Vinod, for choosing this day. So it's coincidental, but I think it's a wonderful momentous day. Thank you.
Thanks, Ram. We'll have a time for discussions and questions after that. There's a lot of people who registered through the Zoom platform. There's a lot of people who are watching it through Facebook Live also. Please do type in your questions, and I will try and see how many of them I can put across to the panelists. Over to you, Lakshmi, for your opening comments.
Thanks, Vinod. And yes, a very historic moment, I should say. I think one thing that I would like to say is with recognition also comes great responsibility. So I think all of us as professionals also need to be responsible enough when we practice and abide by the law. As Ram said, there is no discussion. So either you follow the law or you will be penalized. So and there is great responsibility, especially in the scientist cadre or the health professional cadre where graduate optometrists have been put. I think that is something that each graduate, each professional should also recognize and appreciate that we are getting this. Although it's a long drawn one. I feel the first advantage, with this is that for optometrists, they become legally qualified independent practitioners, and that's something huge. That's huge recognition in terms of optometry and eye care professionals. And if you look at the bill, it gives the labor code, and according to that, all the classifications as well, which also means that you can travel with the qualification that you've been given, and also do maybe higher studies and things where it was a little bit tough earlier. Now maybe things will become more streamlined. And as Ram said, yes, we're going to grow many, many fold. And in fact, like somebody in the parliament just now was saying that, one nation is known for spreading the virus, and the other nation would be known for spreading medical care. So maybe we become the supply hub for all the medical kind of in the sense human resource. So but having said that, I also would like to first attend to what the nation's requirements are, and then after that look at maybe supplying for other countries and things like that. But as I said, I mean, it's a great moment. It's very overwhelming for all of us, all three of us, Rajesh, Monica, and myself, because we've been looking forward to this. But at the same time, just that word of caution that yes, we all are happy, but I think each one should also be, very careful and responsible here onwards in terms of practices, maintaining medical records, doing best practice standards, following best practice standards, and so on. So there's going to be a lot of demand on competency of each person that comes out, what's required of them, competency of the colleges that are existing in terms of what facilities they have, whether they have NAC accreditation or not, and so on. So with regard to education, I think Monica would be the best person to speak on that topic. But I would say yes, a very, very historic moment. And also it kind of opens up, the other categories which are listed under ophthalmic science. That's the ophthalmic assistant and the vision technician as well, because there were a lot of, they were feeling uncomfortable during some time, saying whether we'd be recognized or not, and what's the future and things like that. I think, with the new education policy and all of that, we'll have to just wait and see whether different models are developed in terms of, how they get a career path and things like that. So that's something we just have to wait and see. But I think it's good. The other thing that I just wanted to say are there are a lot of diploma in optometrists also that are present in the country, which were initially run by RIOs, that's the Regional Institute of Ophthalmology. To give a few examples, there's Sarojini Devi in Hyderabad, there is Government Ophthalmic Hospital in Chennai, there's Minto in Bangalore, and so on. So all these people also, I feel, would be clubbed under the diploma banner. And the courses, I think, would be kind of merged with ophthalmic assistants once the bill comes to place as an act and so on. So that is something I just wanted to say. And yes, that's about it. Very happy today.
Thank you so much, Lakshmi. Monica, over to you for your opening comments, please.
Thank you so much, Vinod. And thank you. I don't know what a coincidence. The debate is going on, and it's the last final word which is coming up from the health minister right now about this bill. And by the time maybe we end our panel discussion, it should be like passing through the Lok Sabha and very soon becoming an act. So I was really emotional. I would say it's happy moment, and at the same time these are tears, because I remember myself, and I'm just 20 years old, 37 years behind when we've been really talking about our regulation, and today is what is coming up into the pipeline. And in between our journey, I think we cannot forget Brian Bolden, who actually came up and really showed us the path, and India Vision Institute, of course, leading that Brian's vision. And I wish he was here with us, but wherever he is, I think he would be equally delighted as what we are feeling today. So as we know that, yes, 2012, the report was formed, and then a task force came in 2015, and the government standardized the national curriculum by this task force, and he announced it in the public domain. The ministry did it, but the universities and the regulation was not there, and hence the standardizations were not building up. So as we understand this bill, what is coming up in this bill is, yes, as one said, there will be a brighter future where you have good work being done, but at the same time you are under the regulation, and all those things which shouldn't have happened, or you've been doing it whatever you wanted to, is not going to be easy now. Since I am more of an academician and I would talk, so as an academician, I look at this standardized curriculum, which says 2,000 hours for a diploma to be certified, and 3,600 hours of education for a degree holder to be coming in. All the universities have to be recognized, have to have some standards. And, there were curriculums where you would say, okay, we do not have a teacher for this, we delete it from our curriculum, and we were managing it out, but it's not going to be the same. You're going to have a common entrance test, and you're going to have an exit exam. So whichever XYZ university or an institution you come out from, unless you have learned the real outcome based or you have understood the education and the skill, you cannot be coming in. So there is going to be a register which is going to be made, and this register, when it takes you as a qualified optometrist defined in the country, means that every 2 years, probably that's what we know today, you will have to have your upskilling, your credits, your continuing education. And all this is why? All this is not only to meet the numbers what the Parliament and the Lok Sabha is talking about in what India needs. The India is also preparing, as it has been discussed, that like vaccine, we're also going to be a hub where they're going to be these allied health workers who are going to be moving across the world and been supplying or filling up the gaps in these numbers. So each one of us, yes, we're not looking at a brain drain, but we're looking at opportunities not only in very future, as industry, Ram had said, is growing up, is going to be not only industry, the numbers, the employment, but with it comes responsibility of giving standards and good competencies. You cannot have mistakes done now, any error done or blunder done, you are under that review of law. And if you do not do a proper, maybe a refraction or make mistake in a contact lens fitting, you are bound under this legal law, which can take you. So what I feel, yes, we have all these kind of standards to be maintained and things have to be seen. The next, after the act passes, there will be an interim body, which is the most important body, which will form the policies. So there are a lot of gray areas today. If the question answer session and public wants from us to know what will come up, no, it's this interim body, the center which will define the outline, and the states which will be the executors, which will actually tell us what is going to come in, how it will be executed. So bottom line is, yes, we have to now today, as we move into this panel discussion, look at the future, considering that bill is becoming an act, what should be coming in, how we should be joining together, what should be done next. And education is the first message, which I keep saying. You need to be properly educated, upskilled with competencies if you're going to glorify yourself for this bill. So over to you, Vinod.
Thank you so much, Monica. So I know there's one question already on the Q&A thing. So I'll request the participants to type in more questions, but as they're doing this, maybe I'll start with the first one. So in dissecting what would happen going forward, maybe just in terms of clarifying to the viewers, in terms of who can, screen and prescribe and dispense glasses, what changes would happen in that arena? So in terms of, what level of training is needed, I guess some of these things are going to become legal, I guess, once this bill is through. Am I correct?
Ram, you would like to answer that, and I'll add.
Yeah, perhaps.
Yes, there is.
Maybe I think we need to break this down into two different parts, because the first one is regulating education and standardization of education, which I think perhaps Monica and Lakshmi were mentioning. I think that's the objective of this bill. This is perhaps a step towards regulating the industry as we go along. But the first step is to make sure that standardization of education and thereby trying to get the best to the patients. So if you look at also the advice of the committee, and the committee, when they had framed the bill, there's a recommendation that there should be something like less than 2,000 hours of training, which can come under skill development. So they have kept that as an option open. Now we'll have to wait till the bill is passed to see, but this is not only with respect to optometry, it's with respect to the allied healthcare bill. So basically what they're trying to do is they are trying to have an assured, harmonious and assured career progression, but also to fulfill the demand-supply gap in the country on the allied and healthcare services overall. Now coming to optometry, I would say that yes, if you want to, the bill would definitely is going to regulate the education part, and for sure that nobody can call themselves as optometrists without 4 years. That's clear, I mean, with the bill. And nobody can say that. Now, there is something called aid or assistance, which is within inverted commas, which can be used as ophthalmic sciences, which can be below 2 years. Now, this is an area where the bill will have to come, the law will probably, as we go along, we'll come to know about it a little later. So, to me, it is a great step forward, because first is the base. The standard of education has to be regulated, and that's been done. And that's itself a huge step. Now, the next few steps are going to be much easier. The other one is, you're talking about the other medical devices, bill and so on, for the manufacturers, the retailers and so on. Both are independent. I don't think we need to mix many things here, but it will lead to regulating the industry in a way that the consumer, ultimately the patient and the consumer, should get the best. And I think the government is doing that keeping that objective in mind. And it should be also affordable eye care. I don't think we should do anything which enhances the cost of eye care. I think that's something which we need to also keep in mind. So given that, I think this is my assessment of this at this point of time about the bill.
So Vinod is actually wanting to know, I think he's wanting to know who prescribed the glasses. So if we are talking about optometrists, which the codes, if we go by the codes which are international and adopted by this bill, the optometrist is of course independent. Then comes the ophthalmic assistant or the person which is a 2-year person who would be assistant and under supervision. But then below 2000 hours, as Ram, you have said, this item has actually been not accepted by the Rajya Sabha. So there is the debate which is still lying, and maybe the policy makers would come in. So the regulation framework of what that person can do and all will be much later stage. They want to come up into defining it. So opticians themselves, as I had known some of the associations discussions, are not the prescribing authority in the spectacles. By themselves also, they're not accepting it. They're the dispensers. So I see a diploma holder or an optometrist who's 4-year qualified as the prescriber of these spectacles. Rajesh, sir, you would like to add to it?
Yeah, see, ophthalmic science professional will be 3. One will be optometrist, one will be ophthalmic assistant, and third is vision technician. Optometrist, the code, the international classification of services code, so ISCO, that is under ILO, International Labour Organization. This is how it is recognized all over the world, just like the some opticians or others would understand the HSN code for products. So we have these codes. When they start with 3.2, which is an optometrist code, that is an independent professional. When they start with 2.2, which is the code for ophthalmic assistant or for the vision technician, they are always supportive staff. Although we do believe there was a very nice phrase used in the discussion, which I would like to read out, that these professions also work to optimize patient outcomes and attend to overall prevention, promotion, wellness, and management of diseases. And all these professionals have great importance. We are not here to see, okay, 3.2 is very important and 2.2 is not important. They are. So the prescriber will be optometrist or maybe a medical specialist, meaning an ophthalmologist. So these two will be prescribers. Others can assist. And optician so far is not covered, but as the Medical Devices Act comes in, as Mr. Ram was saying, then we will have certain qualification required for registration of an optician who would be able to dispense those. Right. So all this is now falling into place. Rather, this may be end of a big struggle, but it's beginning of maturing of eye care system in India, or rather the healthcare system in India, wherein a professional who is not an MBBS also gets his role. And here I would like to say just one final sentence for this particular answer. Despite the existence of this whole profession of ophthalmic sciences group in India for over 60 years, it has not yet occupied the governing space that it deserves by merit. And now that governing space which it deserves by merit is being provided and we have to fill it very judiciously, very responsibly, and show the world that yes, we deserved it, and we are now going to serve the country and the people of the country. So finally, the dispensing may be by the optician, the prescription will be by ophthalmologist or optometrist. Thank you.
Yeah. Now, just what I'll do is I'll take some questions from the audience and put it across. And what I suggest is maybe one of you answer. There's one question that says some states like Kerala, Rajasthan already have a state paramedical council. Will optometrists need to be still registered with them, or these states will also get a separate council? Go ahead, Lakshmi.
Yes, we've had some of the Optometric Council of India members also ask us the same thing. There's Rajasthan, there's Madhya Pradesh, there's Kerala, and few other states which already have the Paramedical Council. And that council, as of now, registers only the public sector people. In the sense, it registers ophthalmic assistants. Even if you go as an optometrist, they don't register you. So their purview is only with regards to the public sector ophthalmic assistance. But this council will become defunct once the other act comes into play, and they will be overruled by the state council that will be formed. So all that will be merged into the state council that comes.
Thanks, Lakshmi. That was quite
Right.
clear and straight.
I like to add just one phrase here. There is a phrase in this particular act which says this will have an overriding effect.
Overriding, absolutely.
So that means all other previous acts are gone.
They will override completely.
Yes, this will override.
Thank you. Thank you. That's very clear. Now, just there's one other question which I'll paraphrase. I think in terms of people who have qualifications other than a 2-year degree, who are right now currently, practicing, what happens to them?
It's $1 million question. I think it's we cannot be so sure to define now. It's the interim body and the policies, how it is defined. But less than 2,000 hours from an unrecognized institution, as far as this bill language says, is not going to be under this review. That's what I understand from the draft. Yes, Rajesh.
Maybe just to follow up, is there a grandfather clause or anything where some of them get absorbed? Rajesh, maybe you could touch on that.
See, currently it is not defined. Point is, this particular act is not the real full law. After this, the rules. These are just the directive principles kind of thing. And within this framework, rules are yet to be framed, both at national level and at state level. And state level rules can be little different from one state to other. So let us see what actually comes out of it within the next 6 months, and we will be watching it, and maybe sometimes we'll be giving inputs to it when requested for. But right now, nobody is clear about it because that depth of rule making has not yet been done. But as far as
you're right to say, you're right to ask grandfather clause. Maybe government cannot just let them be on the roads without any. So there has to be some bridging done. It could be a bridging by some education pattern or an exam, but that path has not been announced or defined. It's the interim body. So definitely they will not get a straight journey into the register of this centralized register. There will have to be some bridging or a rule regulation which will have to bring them up to a standard which is going to be the base.
Very right. I agree with you. So the government just can't leave you just like that. Today you switch off the thing. It cannot be. Something will come up.
I agree with you because I think, it's a matter of time before a lot of these things get clear through the interim council and various state councils. There's one question that says that, do they need to requalify themselves every 2 years? Is that part of the requirement?
Yes, that's part of the bill.
Continuing education is part of the requirement.
So I remember Optometric Council forcing that you please continue to have your credits earned, but this credit will now become mandatory. You cannot renew your license if you have not uploaded that credits. It means it has a meaning. What we studied in our graduation is totally obsolete now. And every 2 years, new technologies are coming, new things are coming. An optometrist cannot remain to be an optometrist unless if he is updating his knowledge and things like that. So each one has to be upgrading, upskilling, and then only after the credits have been uploaded on this register, it goes into it.
Just to go back on your question about prescription rights, even today, if you see, ophthalmic assistants are in the public sector. That means they follow under the ambit of somebody else who's supervising them. And similarly for vision technicians as well. So that was what will continue even post the bill, because they would be under the supervision of somebody else when it comes to prescribing. But as far as the 4 years are concerned, then it would be independent practicing rights. I think the bill is passed. That's what I'm getting to hear.
Yeah, I think the ministers just finished off.
Okay, good. Yeah, look, once the bill is passed.
All the eyes are coming.
Congratulations, everybody.
Congratulations to India and to the world. Yes, the world is also looking at us.
Yes, the world is looking
Bill
at
is passed.
Excellent, excellent. So,
it's just like having these
Appreciate the timing, what was set for this, so that we could be live here and enjoy
Yes,
very
absolutely.
nostalgic moment.
goosebumps. It's goosebumps
Yes.
coming in because it's
Yes.
the beginning. It's actually the beginning of, I mean, at the end, you don't regret that, yes, you have chosen a profession.
Yes,
You can opt
we
in.
all have put in years.
I think congratulations to the
decades,
profession.
3
Everyone.
decades,
Yeah.
many decades.
It
And-
is.
and I think
31 years for me, I think 40, 38 for Monica. So we all have been into it.
Congratulations to everybody, and a big thank you to Brian. I miss him today, Vinod.
Yeah, no.
I miss him a lot.
But a huge congratulations to everybody, especially Rajesh, you, Lakshmi, Monica. I think you've been,
No,
at the
we are
front
only
of
the
it for-
faces. There are so many unsung heroes, and all credits to them. Without their support, nothing happens.
And yes, the industry and everybody, and of course, I think there is onus on all of us now, even including Ram as industry.
I
If
know.
we're thinking about upgradation, upskilling, education, standardization, we should be, our happy moments have to be carried forward to be remaining happy. Otherwise, whatever's been done, we lose it. If we don't.
So just moving on with the discussion then. There's again one question on telehealth. Would telehealth qualify under the term under supervision? I know right now technology plays a big part. Rajesh, go ahead.
Yeah. See, currently the telemedicine is permitted only to RMPs, registered medical practitioner. The caregiver can provide information of the patient where the next to the patient is the caregiver, whoever that may be, and the health care provider, who is the RMP, has to ascertain and use his own clinical discretion to decide whether that information is adequate for him to take further action. And there's a limitation to how much can be prescribed in first meeting or in second or in third consultation or follow-up consultation. All those guidelines are there in telehealth. Now the next step would be, will an optometrist be also permitted to do a telemedicine kind of practice or teleoptometry kind of practice? And once that is decided, then yes, optometrists will also be able to do. Either at the other end, there can be these assistive cadres starting with 3-2, or there can be other caregivers, maybe just the brother of the patient or a caretaker, whoever, and then optometrists will also be able to help out in the medical issues. But otherwise, telemedicine for the time being, as of today, is not there for optometrists to do. It's only for registered medical practitioners.
I
Thanks,
think
Rajesh. And
we
just
should
move-
ask for. When the interim body is there, I think we should look forward to this coming in, because if we have to reach the remotest areas, the optometry has to be involved in this.
True, very true. There is a valid and on merit reason to give it to, but it's just been few minutes that optometrists became an healthcare professional. So give them some time to make
so
this nitty-gritty change.
what I suggest is, let's be quite sharp in our answers, because then I can take more questions and put it across.
This also relates to the earlier question that Ram asked about online, things that happen in terms of online sales and stuff like that. When you look at teleconsultation and things, Ram, if we have to pick a leaf from what happens outside of the country, internet sales definitely is here to stay. So that is something we cannot fight, and that's the future. So I think that is something we have to digest. But at the same time, they can be regulated internet sales, which happens outside as well. That means if somebody wants to buy, the prescription is scrutinized. Whether they have had a regular eye examination by a qualified person is scrutinized. Then an optometrist certifies it, and then after that, the sale happens. And these are not through places like Amazon or anything, but through qualified practices which have their own websites. So once it's converted into that, I think that would be more of a reality in terms of opticians and others. And I think that's the direction that we need to take as well. And to go back into your grandfather clause, Vinod, everything is like open because the interim council will decide upon that. But again, if the interim council people look at models that have proven right in other parts of the world, usually it is a blanket statement saying people who've been practicing for so many years. It can be that, or it can be people who've been practicing for so many years give a certain test, but they're not called as whatever is given in the act if they don't fall under that many education hours. So they would be just given a certificate where it says you are allowed to do A, B, C, D, depending on what your competency level is when it's been checked. So in the sense, over a period of time, these people will become, lesser and lesser as the number of optometrists, ophthalmic assistants grow. And then after that, then that will be like a defunct thing, like what happened with the RMPs when the medical MCI came into place. So that is these are the two paths that one can take, but it depends on the commission which comes. So either it is test of competency, but not on the live register, but they would be certified to do whatever their competency is, 1, 2, 3, and they would be saying, I mean, the certificate would say that you can do only this and nothing more than this. Either that, or you take a blanket statement saying people who have been practicing for this many years and not qualified can, again, be certified to do only 1, 2, 3, and then nothing more than that.
Thanks, Lakshmi. This question is for Ram. Ram, what do you think is going to be the impact on the industry overall? The optical industry, especially the small and medium-sized players.
I think there's a lot of misconception and misnomer going around in the industry saying that, oh, the optometrists, if they become stronger, then the opticians will probably lose their the place in that. It's not true. Actually, in fact, even today we all coexist. This is only a regulation to say that, now even for opticians, for instance, everybody is called an optician, and tomorrow somebody can just start an opticianry course, a store outside. I think a time has come to have an Opticians Act in India to make sure that there is not everybody, Tom, Dick and Harry doesn't open an optical store, and there's dispensing optical qualification which is required. And the grandfather clause perhaps would come there definitely in place, because this is more relating to the sector. As far as this is concerned, I would not hazard a guess, because this is a law today. And I don't want to interpret a law based on what my understanding is, but I think on what is written on the law. And I have a feeling, my gut feel says that there will not be any deviation of grandfather's clause which will come in. There will perhaps be a bridge course which they will ask you to take, and they will give some period of time for people to enhance their skill. But I do not think there'll be a compromise, because this is an healthcare services which are rendered, and I do not foresee that happening. But again, I'm only hazarding a guess, because I have not seen the law per se, but this is my thought.
Yeah, I would support you, Ram, because the feeling that I get is the same, that there will not be any compromise on this sector, and most probably they would be empowering the educational institutions to run some courses over a period of time for them to upgrade. And that's what I feel would happen over a period of time. And this would be in such a way that even working people can take the course. So it would be something like partly online, and then after then they'll have to upgrade their skills, and then after that there would be an exam, and then after that if they show their competency, then they get into the register. That is what I have a feeling, but as I said, you never know what happens.
Thanks, Lakshmi. The next question, Lakshmi, I think this is totally focused, for you. What happens to existing OCI membership once the council is formed? This is one of the participants asking.
The membership would be all the existing members would be part of the the council, because we would be handing over the entire register. We have also shared the way that we scrutinize the applications and all of that earlier also with the ministry. So the existing people, all the records and everything will be shared. It is also part of our MOA and AOA. It's written in that constitution saying that once the council is formed, then our duty is to hand over all the membership data to the government.
Thanks, Lakshmi. The next one is, so you got a national council and you're going to have various state councils. Health is predominantly a state subject, I guess, with the broad guidelines set in a national framework. Can someone highlight a little bit on how this whole thing would work?
Answer this?
Yes.
See, the primary basic rules, which would be, as I said, the guiding principles, are there in the act made by the parliament. Now, this act will be then implemented into a national commission. The national commission will fill in the skin and flesh into it and just make it into some guidelines which the state cannot deviate from. Actual functioning on the ground, the operations will be by the state. Anything which the controls, the setting up, the licensing, everything will be done at the state level. The state register will be populated by actual practitioners who will apply to the state. In my state council, I wish to be registered. And the national register will be populated automatically from state registers. The control, the same is there for the legal profession or many other professions, for medical profession, all those things, that's how it works. So the control or the interaction of a practitioner will only be at the state level. National level is how the state council will talk to the national commission. So this is how it's going to be working, and various committees and things will
I would add here.
Yeah.
Suppose you're practicing in Haryana, in Gurgaon, you are going to be registered in it. Suppose I move out of it and move to Maharashtra, I'll have to re-register in Maharashtra. That's how it is going to be. It's not that I'm born here, so I would have to be under this state law. It's where practice is, just to add, that will be the law there. And then there is a central register, which also the medical doctors continue to do. This is a national and there is going to be a state register both.
Just to add, Rajesh had mentioned, I think the state council will have comprise of one director or additional director, which will be the ex officio members. There'll be 2 members from the medical colleges run by the state government. There'll be 2 representation for ophthalmic sciences. So there'll be 2 for each state. And then there'll be 2 persons from the NGOs. But specific to education part of the NGO. This is what has been, I think this has been also adopted. The clause has been adopted. So I guess this will also be as a law. So this perhaps could be the guideline for a state council.
The next question, this is for you, Monica. I know you kind of highlighted the number of contact hours one needs to get a degree or a diploma. And this question is, in terms of faculties, is there anything like a standardization that's needed for faculties?
Okay, so I would rather for faculty, first thing is there is going to be an entrance test. So you will fall under a national entrance test as a faculty to be registered as an academician in these professions also. At the same time, the higher education says nothing less than a postgraduate becomes a faculty. However, the new education policy says by 2022, Each one has to be a PhD to be enrolled as a faculty in the university or a higher education institution, which is going to be impossible. So there has to be a kind of window period where it will say PhD is desirable but not mandatory for a certain period of time. But in any case, post-graduation becomes mandatory if somebody is looking for an academic career. And along with it, each faculty, like we have for every discipline, engineering, management and all, there is a NEET exam, which is the National Entrance Test exam. This is a part of the bill also. So everybody has to pass through it. Now, when you're talking about education, just to add on, of course, a lot more questions, I'll be very crisp to say the new education policy bill, which is simultaneously going to be an act very soon, and 2022 it will be implemented. It has got some differences to what our bill says. That bill says, education policy says, if you pass out in 1 year, your certificate, 2 years diploma, 3 years a graduate, and 4-year graduation with research. But here in this health bill, it says 2,000 hours, which is minimum of 2 years. And then it says 4 years, or which is 3,600 hours, right? So the point is the new education policy, of course, what will be adopted out of it is this certifications, the online teaching programs, the upskilling. So thanks to COVID for that. Yes, government realized that allied health workers and health workers are more important, and they were very much a part of this whole phenomena which has happened. We also learned a new pattern of education, and online teaching is a reality which even the higher education is now making a part of the system. And then credit exchanged. Credit exchange means the student is not going to be bound to one university. He can pick and choose where he wants to learn that skill from.
So I think we are getting to a stage where we have time for a bit of closing comments, and I'll probably give a minute each to each one of you. And what I would be quite keen is just maybe using this bill as a guide. Just give your impression on how this profession in India would be 5 years from now. You know, what kind of changes you see happening, you know, which you know would kind of shape, build, do various things for the profession. So I might give you a few seconds to think through it. And it's going to have an impact. It's going to have an impact. It'll take a few years for the impact to be felt and kind of filter down. So you know, maybe Rajesh is smiling, so I'll get him to start with first. So don't take more than a minute. So if each one can just comment on that, that'll be great.
Okay, say in the past, until yesterday, we had various groups under ophthalmic sciences, vision technician, ophthalmic assistant, optometrist, and each one of them thought, this is my opinion and this is my opinion, this is how the policy will be, we will go this route. Now all that is over, that is past. We are one group, we have to now be professionally symbiotic, helping each other out and growing together, because now is the law which binds us. We are not different. So we are all now united into one bouquet, in which the bouquet will bloom when all three of us are into symbiosis and helping out each other to grow. And all good wishes to every optometrist, ophthalmic assistant, and vision technician in the country to grow and prosper.
Thank you.
There would be mutual respect among all the professionals that are listed as well, and one would acknowledge the other's presence very well. And I think even you know, there's always been a complaint that optometrists don't go to far off regions and things like that. But now with the law coming in, now that they know that they are empowered by the law, I think optometrists would also begin to spread out from the metros because they've been given this thing of independent practice. I think like in 5 years, you would get good quality education, both in ophthalmic assistant and as far as optometrists are concerned. And that would also feed into postgraduate courses such as MSc and PhDs. So we know the dream that both of us had about, you know, 100 PhDs long back. which Brian was talking about, I think it will be a reality. 5 years is too soon, I would say, to look at 100 PhDs. But I think 5 years would be a good start to look at some amount of reasonable, good qualified PhDs, and then from them to grow to reach 100. So I think he's sitting up there and having a good laugh.
Thank you, Lakshmi. Monica?
Yeah, I see 5 years down the line. I would talk in terms of the eye healthcare system of the country. It's going to be not 5 years, but very soon, at least the public now knows. I would say everybody knows what is an optometrist in India mean, what does an ophthalmic assistant mean, what does an ophthalmologist mean. And there is going to be a very good synergy between all of them, because each one will know their role. There'll be perfect co-management between an ophthalmologist and an optometrist, prevention of blindness, and the goals which we are talking about. I think the synergy which will come in, because the public will understand who each professional is and what this professional can do. So I look forward not only that we will be having a good healthcare system in the whole country, but even we have a lot of opportunities for some young ones who aspire to move out of the country and build it. And industry integration is next 5 years going to be big thing happening for all of us. Thank you.
Thanks, Monica. Ram?
Yeah, I think most of them said all. I guess it's going to be wonderful time ahead. If you, I estimate the industry to be around say 13 to 14,000 crores at the retail level. I would bet at around doubling in 5 years' time with this bill, because this bill, and actually we should see it in the spirit of how this is going to help the industry. The industry also has a rightful place as different stakeholders like opticians, and the optometrists now have a role to play in that specific arena where they are competent enough, and which is rightfully theirs. And I think opticians have the rightful place to play around. I think this will enhance, and this recognizes each one's need. And as long as we coexist and we recognize the coexistence, I think the industry will grow. I think all of us should talk in one platform now. Eye care is one. There's nothing like opticians, optometrists, or ophthalmologists. It's all the same. And as long as we reach the needy, we reach at a quality which is now standardized. I think great day, and I think I'm really pleased to be part of this forum.
Yeah. And I would just put the bottom line. We all have to be united. Yes. We just can't say, I'm an optometrist, so it's my day. It's everybody's day. And if we don't do that, we all will be in trouble.
Yeah. So again, just in closing, it's a great day for the profession. Congratulations to everybody who's been involved, and especially our three of our panelists, Rajesh, Lakshmi, and Monica. They've been at the forefront for years and years, and I'm sure they'll be thrilled. I'm sure there's a whole bunch of others who worked very hard. Thank you, Ram. Ram has been part of the profession, and he's been a great supporter for eye care, primary eye care, optometry, and thanks for taking the time. I know there are many more questions here, but I don't think we got time to address all the other questions, but we'll get an opportunity in the future. Thank you so much.
Thank you everybody.
But I think you should
real historic one, this recording of
come up with a lot more questions which are unanswered, and I think we'll come back again.
Sure.
Thank you, everybody. Thank you.
Thank
for
you.
Thank you.
Thanks, everybody.